Internal Medicine, Basic, for Semester 5 of the Faculty of Medicine. Internal Medicine, Basic. Internal Medicine, Basic, for Semester 5 is one of the important courses in medical education. This course provides a foundation of knowledge about the diagnosis, management, and management of various diseases that occur in the internal organs of the body. The following is a detailed and systematic explanation. 1. Introduction to Internal Medicine. Definition: the science that studies diseases that affect the internal organs of the human body, including the cardiovascular, respiratory, digestive, renal, endocrine, hematological, rheumatological, and other systems. Learning objectives: recognize and understand the mechanisms of disease, pathophysiology. Understand the symptoms and clinical signs of disease in certain organ systems. Learn to make initial diagnoses and management. 2. Main topics in internal medicine. Basic 2.1 Cardiovascular system. Main topics: coronary heart disease, CHD, heart failure, hypertension and its complications, arrhythmia. Learning: understanding the anatomy and physiology of the cardiovascular system. Pathophysiology of diseases such as atherosclerosis and hypertension. Use of diagnostic tools such as ECG and echocardiography. Basic management of cardiovascular disease. 2.2 Respiratory system. Main topics: chronic obstructive pulmonary disease, COPD, bronchial asthma, respiratory tract infections, pneumonia, tuberculosis, acute respiratory failure. Learning: anatomy and physiology of the lungs, pathophysiology of ventilation and perfusion disorders, physical examination of the chest, interpretation of chest X-rays, and blood gases. Basic management of oxygenation and ventilation. 2.3 Digestive system. Main topics: gastritis and gastric ulcers, chronic liver disease, hepatitis, cirrhosis, inflammatory bowel disease, IBD, intestinal obstruction and peritonitis. Learning: anatomy and physiology of the digestive system. Mechanisms of disease such as gastroesophageal reflux, GERD. Physical examination of the abdomen and endoscopy. Management of gastrointestinal infections and liver disease. 2.4 Endocrine system. Key topics: Type 1 and Type 2 diabetes mellitus, thyroid disorders, hypothyroidism, hyperthyroidism, adrenal disorders, Addison's disease, Cushing's syndrome. Learning: function of hormones in regulating metabolism. Pathophysiology of hyperglycemia and hypoglycemia. Interpretation of laboratory tests such as HbA1c, TSH, and cortisol. Management of acute hypoglycemia and control of chronic diabetes. 2.5 Renal and urinary system. Key topics: acute and chronic renal failure, urinary tract infection, UTI, kidney stones and nephrolithiasis, learning, excretory function and fluid electrolyte homeostasis, mechanisms of acute kidney injury, complete urinalysis and electrolyte interpretation, dialysis management in renal failure. 2.6 Hematology. Key topics: anemia, iron deficiency, megaloblastic, leukemia and lymphoma, coagulation disorders, hemophilia, DIC, learning, blood cell production and function, complete blood smear and peripheral blood morphology interpretation, management of acute and chronic anemia. 2.7 Rheumatology. Key topics: rheumatoid arthritis, systemic lupus erythematosus, SLE, gout and hyperuricemia, learning, pathogenesis of autoimmunity, identification of symptoms such as joint pain and swelling, laboratory tests such as ANA and uric acid levels. 3. Internal medicine learning methods, basic 3.1 theory and concept, lectures and case discussions on various internal organ diseases. Literature studies from textbooks such as Harrison's Principles of Internal Medicine. 3.2 Clinical examination, anamnesis, explore the history of the disease, symptoms, and risk factors. Physical examination, systematic on the heart, lungs, abdomen, etc. Interpretation of diagnostic results, ECG for heart disease, chest X-ray for lung disease, complete blood count for hematology. 3.3 Laboratory practice and simulation, use of tools such as stethoscopes, oximeters, and glucometers. Training in interpreting laboratory results such as kidney function, BUN, creatinine. Simulation of acute clinical case management, hypoglycemia, asthma exacerbation. 4. Final learning objectives. Students are able to recognize early symptoms of internal organ disease. Students are able to analyze the results of clinical and diagnostic examinations. Students understand the basic principles of internal organ disease management, including pharmacological and non-pharmacological therapy. Prepare students for advanced clinical practice. Conclusion: internal medicine is a very broad branch of medicine and covers many organ systems. In Semester 5, focus is given to the basics of theory, pathophysiology, and diagnostic approaches. The ability to understand internal medicine holistically is essential to proceed to clinical practice and is the basis for more complex patient management.